Dr. Wen, you're sort of at the front line of this. You and I had dinner a few months ago, and I mean, some of the stories you shared were pretty remarkable. You're an ER doctor. How did you get into this? Why is this issue so important for you?
Actually, very similar story to Crystal's. I saw a patient who I got to know over the course of her getting treated in the ER. When you know someone very well as an ER doctor, you know there's something wrong. But this woman was in her late 20s. She was a competitive swimmer. She tore discs in her back and started out with prescription pain pills, but then got addicted to them and then switched to heroin. And this was a woman who was in a downward spiral, and she recognized that she was losing her job. She was about to lose her kids. She was homeless, and she came to us basically every week in the ER. And she knew that she needed help. I mean, this was someone who came to us every week saying, I want help for my addiction. And it's one of the worst realizations as a doctor. It's one of the most humbling things and worst feelings as a doctor to know that you can't help them. That what this patient needed, what so many of our patients need, is treatment, addiction treatment at the time that they're requesting it. But we couldn't give it. I mean, we would never say that to someone who has a heart attack. We would never say, go home, and if you haven't died in 3 weeks, come back and get treated. So that's what we faced, and I remember that I talked to her this one time about getting into treatment. She really wanted to do it. We set her up with an appointment, but it wasn't until 2 weeks later. And she went home that day and overdosed and came back to us in the ER. We tried to resuscitate her, but we couldn't save her. And I think about her all the time because she had come to us so many times requesting treatment. And yet, clearly there is a difference between how we treat her and how we treat everybody else. Because we need to recognize that addiction is a disease. If we treat addiction like a crime, then we're doing something that's not scientific, that's inhumane, and it's frankly ineffective.